The Tel Aviv Sourasky Medical Center is Israel's largest general hospital. The key to our successful operation was the decision to have a single comprehensive system that integrates data from all the hospital systems and provides valuable operational insights, which are turned into actionable items in our daily operations. With OpisoftCare, we are able to increase our profitability by 30%, while increasing the utilization of our operating rooms by more than 17%. The implementation of the healthcare performance management system has created an organizational change. We were able to reflect the hospital strategy across the entire organization by defining departmental goals and performance metrics. We also use it to perform predictive analysis. We analyze evolving trends and risks, such as identification of activities that are becoming less attractive. Everything is correlated in order to make informed decisions based on solid data. Through the healthcare performance management, we aim to provide insights for the physicians to improve patient outcomes. For example, one of the departments have noticed an increase in bleeding after a certain surgical procedure. In the analysis that we performed, we identified a component in the treatment that has contributed to this phenomenon. After discussing these findings with them, they have decided to change the treatment protocol, resulting in both clinical and financial gains.
The information and measurements that we receive are an essential part of the ER's daily operations. The system provides real-time statistical information, including temporary overloads, the number of patients waiting for the various procedures, and more. It is an essential management tool, which we use to fix problems, solve bottlenecks, and optimize all the related services, such as labs, imaging, experts, and more.
The system has completely transformed the way we manage the operation rooms in terms of their utilization as well as the improvement of other processes. We have a set of parameters that examine the departments regarding the daily utilization of the operating room. It allows comparison between departments and the examination of trends within each department. This set of parameters, called Operating Room Allocation Program, includes three basic parameters: the entry time, the turnover time, which is the time in between operations, and the time the department finishes its day, compared to the time it was expected to finish. We have used these parameters not only to compare between departments, but also to evaluate the performance of the departments in the large and the small operating rooms, which are used for ambulatory purposes. We have seen variability between the various departments, and we have seen that the departments that excelled in the small operating rooms also excelled in the large ones. Every year, we have seen a dramatic increase in the general scores of the operation rooms and each individual department. Our ambulatory operation includes 180 outpatient clinics and 1.6 million visits a year. Each clinic manager, nurse, or secretary can independently access the system and see their activities. I can identify any decrease in activity from a certain HMO, I can solve bottlenecks, and I can monitor the activity of a clinic while looking at their financial performance to evaluate their profitability.
שאני מדווחת להנהלת בית החולים על ירידה מסוימת באיזושהי פעילות.
מבחינה תפעולית, אני לא יכולה לדמיין.
From the operation standpoint, I cannot imagine managing the hospital without the ongoing data that I receive from the system.
יש דוחות יומיים שאני מקבלת מבחינת המחלקות השונות בזמן אמת.
התפקיד הכי חשוב של ה-BI
OpisoftCare brought a cultural change to our organization.
זה בלהביא שינוי תרבותי לארגון. ובעצם מבקר...
Without OpisoftCare, I wouldn't be able to manage, especially in such a large operation.
במיוחד במערך כל כך גדול.